Oh, I thought it was great. It was both very informative and really instructional.
I really enjoyed the course. I thought it was extremely helpful. Even though during residency I felt very prepared to face a patient in the operating room, but facing the oral boards is a whole different story. And so the course was very, very helpful because it focused on specific cases and it taught us how to answer the questions as the board would like.
I think the course is an excellent course. The reason is because when I started this course, I didn't know how to approach the materials, and there was, as you know, there were so many books out there. But this course focused on the important stuff for the exam, and I'm very, very happy that I came to here.
I think Dr. Ho puts on an excellent course. He gives you very good course materials. The consultant guidebook contains a wealth of information that's very comprehensive and contains very nice sample answers to very common test questions.
I really enjoyed the course. I really liked the fact that it was very interactive, and I learned a lot. I think Dr. Ho is an incredible teacher. He really knows the material very well, and he's very effective at teaching.
I think the course has been amazing. They really go over all of the basics and make everyone feel very comfortable. We do a lot of practice and really hit all the highlights that you need to know for the oral boards.
I was very impressed with the course, with the preparation of the materials. It's extremely thorough and provided a good basis for preparing for the oral board examination.
I thought the course was fantastic. Very well run, very well organized. We got to take a number of practice exams, both with very good examiners, Dr. Ho himself, and practiced numerous times with other participants in the course.
I thought the course was fantastic. Dr. Ho has a great grasp of anesthesia knowledge, and he's a very engaging speaker.
I really enjoyed the course. I think it was very helpful.
I've really enjoyed it. I'm really glad that I've taken it. I was intimidated when I thought about the oral boards before, and now everything seems more familiar, but I also know how to approach each question so that I feel like I've already outsmarted the examiner, and that makes me feel a lot more comfortable.
I think it's a unique approach and something that wasn't really delineated in training, and so I really enjoyed having that perspective given to us and taught to us by Dr. Ho, and I think it actually has helped a lot in how I think about how I'm going to do the practice of anesthesia and how I'm going to train for preparing for the boards.
I thought it was fantastic. I mean, I've never really seen this approach before, not even during residency, and this was extremely helpful for me.
It's an excellent approach. I think, as I said, like everything is related to the exam and focus on the exam, and help me in general as a doctor in the operating room how to manage my patient in a better way.
I think the consultant approach is a great approach to take towards these questions because it gets you thinking about the entire patient, not just the preeminent issue at hand. He takes a very detailed approach to all the different body systems, which can help you answer some of the subsequent questions later on in the stems.
I really enjoyed it. It makes a lot of sense that we think of ourselves as learning to become consultants. I feel coming to the course, I've really we're now able to become a better consultant, and I feel like it helps us not only see the value of learning, but also the value of how it's going to help us manage patients better.
I thought it was very effective. As opposed to simply memorizing material, he's trying to help us become better anesthesiologists and consultants, as he says.
I thought the approach worked very well. He works mainly through dissecting cases, but takes each main problem in the case and looks at it from a consultant's approach. What information do I need to know about this case, about these patients, to enable me to take the best care of them and to explain to others rationale for my decision making.
It makes anesthesia, I think, a lot better approach. I think it has changed my practice and the way I think about cases a lot more.
I think that it's very important that we think of ourselves as consultants and that we develop a professional demeanor, and that's one of the things that he stresses, and not only in the oral board, but also within our profession, and I think it was a good opportunity to practice that.
Absolutely. The way I think about the boards is completely different since I've gone to this course, and has actually helped me focus into details that I need to go over and things that I don't probably need to focus on. So it's really been a better structured approach than what I had before I came.
Definitely. I actually didn't really know what to expect in regards to oral boards, and I have never really had a training that educates you on how to approach the oral board, so this was extremely helpful and valuable.
Absolutely. When I started the course, I didn't know how to start, how to study, how to read, but now I know exactly what to do and how to prepare for the exam, and I think I'm in better shape now than 5 days ago.
Yes, it has. He's got me thinking of a more holistic approach rather than just the immediate concerns for the patient, which I think are helpful because that's how the questions tend to go.
Yes, I feel like coming here just really opened up my eyes even more so to how important it is to have a good knowledge base and also to see the different ways in how you can use that knowledge base to approach very difficult clinical situations.
He definitely changed the way that I'll definitely study for the oral boards, focusing on differentials and focusing on really our ability to predict the questions that they're going to ask on the exam.
I think so, definitely. Definitely a more thorough approach to evaluating each question and preparing my answers.
Most definitely. I think that my ability to dissect the case stems has improved dramatically. The way that he looks at the problems and then predicts what questions and further problems the examiners will likely lay out for you, I believe enables you to much better prepare in that short amount of time that they give you.
Yes, he's taught me how to dissect the stem better, how to go about thinking about how to answer questions.
Yes, he made it seem a lot more approachable, not so scary, and sort of gave me a focus as to how to study, not just study everything.
Definitely. Well, first of all, it made me hunker down, and I have a really busy professional training life. It gave me an opportunity to really immerse myself in it, and now I have a more systematic approach to studying the different topics and practicing more questions.
Oh, Dr. Ho has a great teaching style. I actually really enjoyed it. Based on my experience in residency and at my institution that I work at now, I think he's actually probably one of the best teachers, and enjoyed being at all the lectures.
Dr. Ho's teaching ability is fantastic. I think he has a very good approach to teaching you how to approach the STEM question. He not only teaches you how to dissect the STEM question, but how to answer things appropriately in a fashion that would make sense for the oral board.
Oh, he's excellent. He's just fond of knowledge, a lot of experience. He has doing it for more than 20 years. I think he's right on the money. He's just focused on the things that are important for the exam, and don't worry about the things that not important. And I think he's excellent.
I think he has a wealth of knowledge. He's able to explain very difficult concepts in a concise manner. He also does a great job breaking down some of the ASA practice guidelines into 1 or 2 slides, which summarize the pertinent details, which is helpful for the boards.
He's an incredible teacher, very knowledgeable, and he's also very approachable and very available as well. He's available through not only the course, after the course, but also available through the phone and on webcam.
Dr. Ho is an amazing teacher. He's really able to hit all the highlights that he needs to cover, and he does it in a way that really is able to excite you about learning, and he teaches you to be a consultant for the future so that you can take care of your patients and also so you can pass the boards.
I think Dr. Ho is very impressive with the breadth of his knowledge and his ability to effectively and efficiently communicate what he's trying to get across, so that we can then turn that around and emulate him in order to do well on the boards.
Dr. Ho probably has the best grasp of anesthesia knowledge of anyone that I've ever met or talked to, including all of my faculty during residency. He grasps every concept on a level that allows him to very easily explain it, probably even to people who have very little knowledge of anesthesia.
He's a great teacher. He's very engaging and he's very inspiring. He inspires me to be a better speaker and a better consultant.
Dr. Ho seems to grasp all of the major concepts quite easily and teaches that really easily as well. So it's not like somebody who knows this stuff from years of practice. He really knows how to transfer the information to people who don't know it as well.
I thought that he was humorous, and I was very impressed that he teaches everything himself because he wants to make sure that all of the material is covered, and he does it very thoroughly, and he makes it clear that he's available to you even outside the course if you have any questions or concerns.
I haven't been to other oral board courses. Actually, this course came highly recommended by a faculty member who took it himself when he prepared for the boards, and so that's really the reason why he had said this is the only course to take, and so that's why I decided.
I have not been to other courses, but I've heard very, very good things about this course from my colleagues, and therefore I decided to go ahead and try it.
I've never been at a course, but my friends told me this is the best course out there, and I think they are right.
I've only been to written board courses. This is my first oral course, but I think this one's got a substantial amount of information, and I like the way Dr. Ho teaches you not only the content of the answers, but how to answer and what particular style you need to answer these types of questions.
I had never been to another course, but having been to this course and actually, I had never been to another oral boards course, but having been to other courses for the written boards, I feel like this is Dr. Ho's a very effective instructor, and I approached him about doing a course for the written boards as well, because I think he's an excellent teacher and has a lot to contribute.
I haven't taken another oral board course, but I have to say that this is one of the best sort of courses out there. I've heard that from a lot of different people, and having experienced it for myself, I think it's very good preparation.
I think it's night and day. Having attended other courses for the written boards, Dr. Ho does definitely a better job at explaining his material, and rather than simply emphasizing rote memorization, rather emphasizing learning how to become a better anesthesiologist.
I've not been to any other oral board review courses. I have been to a written review board, and while certainly that's an apples to oranges comparison, I think Dr. Ho, like I said, has a better grasp than any instructor I've seen or dealt with of the concepts and materials that need to be mastered.
I haven't been to any other oral board review courses, but this I would highly recommend.
I think it's a fabulous course. I think it's well worth the time spent, the money spent, and I would recommend it to all of the junior faculty that are preparing for the boards and residents that are preparing for the boards.
I know, I'm just very, very glad that I took the course, and I feel extremely prepared for the boards.
Yeah, I mean, I think I'm very, very happy to be here, and I'm very happy that I met Dr. Ho. I think he's an excellent teacher, and definitely I will recommend this course to my friends in the future.
I think it's a very good course. I think the 6 days is the way to go because it's quite a bit of information, and Dr. Ho does a great job breaking it down and teaching us in a concise manner.
I'm very impressed and thankful I can make it.
That's a great course and one that I would highly recommend.
It's great, and I think everyone should do it.
I think it's a great course. I think everyone should actually do it for the boards. It makes you not only a better test taker, but a better anesthesiologist.
I just wanted to thank you, and I've just been very impressed by the amount of work that went into this.
All right, thank you.
Thank you.